The American Society of Breast Disease is a way of expressing radiology interpretations with other audiences. And it's a way of us to get information from other disciplines in order to know what is important in terms of imaging. So it's more than just additive of we add radiology onto all the other pieces. It's exponential in that we build together a much better impression than we would have each piece by itself. It's very important, very vital for patient care because treatments are changing, ways of identifying patients, high-risk patients, those are changing, and we need to change imaging to fit with all the other things. If we don't communicate well, we'll never do that. Well, there are a whole variety of ways of imaging the breast. There's mammography, ultrasound, MRI, and then all the various biopsy techniques, plus a number of new imaging methods that are on the horizon. The key is not necessarily what each one of them does, but how does it fit in the puzzle? That has to match with the ways of treating the breast cancer. Used to, there was lumpectomy and mastectomy. Of course, those are two big extremes, but now there's a whole variety of other things like oncoplastic surgery, minimally invasive therapy, doing partial breast irradiation versus whole breast irradiation, different kinds of chemotherapy. There's a whole variety of ways of treating people, and it depends upon what the extent of the disease is. So we need to refine our imaging to match the ways of treating the disease. We're now able to stratify patients much more accurately, particularly the old days we were looking at lumpectomy versus mastectomy. It had to do with the size of the disease. The optimal approach to a lumpectomy is not just one thing. Obviously, if you take out too much tissue, then your cosmetic result is not as good. If you don't take out enough tissue, then you may get a recurrence. The key is to do the right amount, and the size and the extent of the breast cancer makes a huge difference. These are usually not discrete little balls that are growing in a circle. Instead, they're often extend along a duct. We need to define that very accurately, and by doing that, we can actually do a better job with lumpectomy and allow more people to have breast conservation than we would have had before. On the other side, you may define some people that would be better suited for oncoplastic surgery, which is another tool. Depends upon the size of the disease, the extent of the disease, so that this can be planned. If you ask the surgeons at our institution, how does MRI help you for surgery? Most of them would say it helps in every case because they define their surgery with the MRI. And by the same token, we also define the adjuvant treatment or neoadjuvant treatment with MRI. We define whether it's effective or not, whether they may need to change to a different treatment. Some people don't respond to tamoxifen prevention. We need to know that. This can be defined with MRI. Well, every patient's different. Every cancer, if you think about it, every cancer also has a personality. It's varied as there are personalities of people. And so to understand that personality of that cancer is very important. And you have to get that from an interaction from multiple specialties because everyone needs to be treated a little bit differently. Everyone needs to be imaged differently. So we have to define things very well. The communication is highly important on each patient. Typically, that's provided with a multidisciplinary breast conference. You have to have input from radiologists, from pathologists, from surgeons, from medical oncologists, from radiation oncologists, also from geneticists, from nursing support. Everybody needs to be on the same team in order to deliver the optimal care. Well, the important part of the American Society of Breast Disease is that it's truly multidisciplinary. We interact with each other. we speak as a voice for the entire field of breast disease. Instead of speaking for, say, I'm a radiologist, I could say that a particular radiology tool is very good, but then again, I'm self-serving because I may benefit from use of that tool. But if, as a group, we all look at it from a multidisciplinary standpoint and make a recommendation, then it's not self-serving. It's for the benefit of the patient. So I think this is one organization you can look at and you say, if we have an opinion, it's probably an unbiased opinion.